All right, you may think heel pain is just that, heel pain. One part of the foot, one cause of the pain, but the opposite is actually true. There are several things that can be the root of that discomfort. And with my next guest, he also has several options to ease that pain. We have Dr. Vincent Staschiak with Mid-Ohio Foot and Ankle Specialist back with me. Good to see you, doctor.
Same here, Robin.
All right, listen, last time you were on, we talked about plantar fasciitis. I feel like a lot of people are aware of that, right? They've heard of it before. Today, we're going to shift to the back of the heel. So tell us, first of all, what is the cause of pain in the back of the heel?
So most commonly, it's Achilles tendonitis. And your calf muscle that inserts to the back of the heel itself begins to, over time, strain, stress due to improper stretching, improper shoe gear, or maybe just genetically a tight Achilles tendon.
Okay.
And over the years, as it's beginning to actually pull itself away from the heel, it's pulling the protective tissue off of the bone itself, leaving open spaces that can cause bumps, known as Haglund's deformity. It can also cause little nodes, like grape-sized nodes, in the back of the cord of the Achilles tendon, which are nodules. Okay. And with the longitudinal tearing, it increases the pain. So it takes years and years for you to actually get to that point. But then once the pain starts,
it's real. And you know what, it just seems it's this domino effect. I mean, it's you have one thing, right? You kind of deal with that, and then all of a sudden you have something way more pressing, right, to deal with.
Definitely.
Okay. All right, doctor, this Haglund's deformity, so what exactly is that? How do you describe that to somebody in its entity?
So it's a posterior superior prominence on the calcaneus.
Everybody
get that? It is a bump on the back of your heel that has been there for 10, 20, 30 years. Most people know it because if they take off their shoe and they see that the back of their heel of their shoe has basically been worn away over time, that's from the bump. But they'll say, well, I never had pain until 6 months ago. It's because that bump doesn't hurt. It's the degradation of the Achilles tendon in that area over time that is causing that tendon to break down, harden up, calcify, and basically I tell them your leg shock absorber is rusting.
Okay.
And you get to a point that you just start tearing it. So if you sit down for 15, 20 minutes or you go to get up first thing in the morning, most people don't even want to put their heel on the ground because they know what's coming.
Yeah, it's that intense pain. You know it's coming. You're avoiding it at all costs.
Yep.
Okay, so you have this treatment that you use for this specifically, and you use it for other things too related to the heel, correct? Tell me about, first of all, this treatment, what it is.
So Orthotripsy was FDA approved back in 1998, but it was actually created about 45 years ago, and most people know it as lithotripsy for breaking up kidney stones and gallstones through focused high intense waves. And then in 1998, the FDA approved it for plantar fasciitis, Achilles tendonitis, tennis elbow, a bunch of other things. So I use it on plantar fasciitis or Achilles tendonitis. And within one session, just like as you're breaking up a kidney stone or gallstone, you're breaking up that calcification, those high intense waves are able to break up all the calcification and thereby returning the flexibility to that tendon, and more importantly, returning the blood flow at the same exact time.
Okay.
So you are going, and instead of having surgery, you're just putting your shoe right back on, have it done on a Friday, go back to work on a Monday, and you just keep getting better as you're inducing the body's natural healing responses to heal everything.
And so I imagine once you get to that point and people are thrilled, right? We've made it to this, we're pain-free. They want to maybe prevent that from coming back, from happening again. Is there anything in the beginning, like even before they get to you the first time, that they can do to help ease that initial cause of it?
Before they come to me, they usually have already tried heel inserts, physical therapy, stretching exercises, a bunch of different rolling type of machines that you can buy off Amazon for 10 or 15 bucks to help. But nothing can break up that calcification. So for 80% of the people that have Achilles tendonitis, that conservative therapy of the stretching, the lifts, the physical therapy, that'll pretty much so resolve your issues.
Okay.
It's the 20% that I deal with that say, I've tried everything under the sun. My only option is have surgery or live with it. I'm here to tell you, you don't have to have surgery. I've been doing this for 24 years, thousands of cases, a high 90% first-time treatment success rate.
And so the actual process, the actual treatment itself, what does that feel like? What does that consist of?
So it's a high-intense ultrasonic wave. You wouldn't be able to take one shock, let alone the 2,000 to 3,000 shocks that I put in there over a 15 to 20-minute period to restore that tissue. So we actually use a lidocaine, which is a numbing agent, to numb that certain area. And once it's numb, most people say the same thing. A little uncomfortable, nothing I can't handle for 15, 20 minutes. Don't put your headphones on, let me do my thing.
Yeah, there you go. And if they've been dealing with pain for decades, What's 15 minutes to get rid of it?
Even the injections, most people will say this is nothing compared to what I live with on a daily basis. So 15, 20 seconds of injections to numb it, because a lot of people are scared of injections. I don't blame them, but
no,
15, 20 seconds.
I get it. Yeah, it's very quick, and then you hopefully end up pain-free. And you said a lot of times it's one treatment, right?
High 90% one time.
All right. So if somebody is out there, do they need a referral? Can they come see you if they have this issue?
You don't need a referral unless you're in.
Insurance requires it, maybe?
And really, that's only for the office visit, because the procedure itself is not covered by insurance because it works.
Yeah.
It was covered for a bunch of years, and then the insurance company said, you know what, only 2 in 10 people are having surgery, 7 in 10 are doing the shock wave. We're not covering the shock wave anymore. So it went away. But I've been doing it for the last 24 years because I believe in totally keeping you off of drugs, out of surgery, on your feet, and get you pain-free.
And so do people out there. I mean, that's the hope, right? It's always, I don't want surgery. Please give me another option, and this is that.
No, surgery, you're going to be down for 3 to 6 months. This, you're having it done on a Friday, you're going back to work on a Monday saying, I'm 50 to 80% better right off the bat, and I just keep getting better every day.
Okay, so if you want that kind of outcome, and if you've been dealing with this pain, Mid-Ohio Foot and Ankle Specialist, the website, the phone number on there, you can reach out to the doctor today. So thank you.
You're welcome. Thank you.